What I intend to do today, talk through the background to the Scottish Police Service very quickly, along with Glasgow, which is the area in which this model is set. I'll talk about some of the issues we face in Glasgow and then move on to the partnership approach. I always preface these presentations by saying if I speak too quickly or I say something that you don't understand, please stop me and we can slow me down, or you can actually get me to explain the terminology that I may use. So, moving on. Yeah, sure. How's that? Are we better now? The background to Scotland: population 5.25 million people, and forgive me, but I use Massachusetts as the correlation between the US and Scotland, because pretty much the same size, geographical area. Policing budget just now $2.25 billion. 8 forces: Scottish Crime and Drug Enforcement Agency and the Scottish Police Services Authority. Scottish Crime and Drug Enforcement Agency look after organised crime across the whole country. The Police Services Authority look after training, forensic science, and they provide the IT support. We have around 17,400 police officers in Scotland, and I actually read on the news this morning that we've actually just went slightly above that, which is the highest number that we've ever had. Volunteer police officers, around 1,400, known as special constables. They are members of the public who volunteer to come out and work with the police. They carry full police powers whilst they're deployed. Excellent resource, and it's something that we cherish back in Scotland. Police staff, 6,200. And you see the crimes recorded there for 2011 and 12. Our detection rate for violent crime is 75%, and our detection rate for homicide 97%. Although I have to say that over the 5-year period, our detection rate for homicide is actually around 100%. Glasgow, Scotland's largest city, again similar to Boston. The difference being, or the key difference being, that we actually have a major issue with knife crime, alcohol-fueled violence, rather than gun homicides. You see there the age range for the 600,000, 0 to 15, around 98,000. If you stretch that to 24, it actually goes to around about 200,000. So a third of our population in Glasgow are 24 and under. Policing budget for the city, $180 million, currently spent across 3 divisions, but that's moving to 1 under the single force. And you can see the figures there for the police officers. The offenders aged 12 to 25 is around 20% of our total crime. Re-offenders 22%, excuse me, and the reported incidents 358,000. Our youth disorder calls, where a member of the public has telephoned the police to complain about young people, is around 8% of those 358,000 incidents and calls. What you will see at the bottom, the figure of $35 million, that's what we spend reacting to youth crime and disorder in the city at the current time.
Sorry, how do you define re-offence? Is it arrest or something else?
Yes.
Arrest rate.
I put this up out of interest. Our prison population is slightly different from what you have here in the US. We don't have the state jails, or the state penitentiaries and local jails. We have a national prison system. So there's 16 in Scotland, 1 dedicated young male offender institution and 1 female only institution which carries adults and young women. That's also of interest because of a commission report last year which has been accepted by our government. We'll actually see that building completely demolished, and we're going to have a completely new approach to dealing with women offenders. I can touch on that later. Average young offenders is 850, that's 750 young men and around 100 young women. It costs us around £420 million per year for our national prison system. However, the figures at the bottom, we pay around $41.5 million per year to keep 100 young people aged under 16 in secure care. That's because in our prison system you have to be 16 or above. Between 16 and 20 you're in a young offenders institution. Above that you go into the adult system. But if you're under 16, and you're in need of care because you're a risk to the community, you'll go into secure care. But as you see, at $8,000 per bed per week, it's very expensive, and I would argue that perhaps not the best use of our resources. Some of the statistics, I think you'll find that they're comparable to here in the US. Being in care as a child, this is the general prison population, mindful of what I just said there about the 100 young people who are in secure care, mindful of the number of young people who are committing crime in the pathways that then leads them into the criminal justice system and into the prison system. If you look at their literacy and numeracy, you see that the average is 11 years of age. That's the skills that the people in the prison system has. So we need to make sure that we're working with education, because we're disenfranchising our young people. Young male offenders, this is what really brought me into youth justice. A visit to the Pullman Youth Offenders Institution last year, where we were looking at how we could work particularly with young men who are the main cause of violence, particularly in Glasgow. You will see there that 89% of the people in Pullman are re-offenders, but also it takes 10 convictions for them on average to get their first prison sentence. So again, you're 7,500 offences in the prison system. Alcohol, as I said, is a big issue. 77% were under the influence of alcohol at the time, 5% under the influence of drugs. But we know that alcohol and crime, particularly violent crime, is something that we need to address. Alcohol doesn't cause the crime, but where violence is concerned, it will exacerbate it and make it more severe. Out of interest, I carried out an exit study and looked at those coming back into the community, coming back into Glasgow. 79 young men, 55 coming into the most deprived areas, and I know particularly from Boston side of things, there's similarities there. But looking at the reoffending rate, you know, that's something that we're just not getting right, the reintegration part of it. So collectively we had to do something about that as well. The last point is something I would ask those involved in the criminal justice system to consider. I found that a number of these young people had outstanding warrants or cases whilst they were in custody that arguably could have been dealt with whilst they were in custody. So whilst they were engaging with partners in the prison system or in the juvenile justice system, they were then coming back into the communities and being rearrested or appearing at court for charges or outstanding issues that could have been dealt with whilst they were there. So, you know, we do all this work in the prison system, we release someone who really wants to change their lives, and then they get rearrested very quickly for something that we could have dealt with. Thought I'd add this in. George W. Bush, some 8 years past. I think that really struck me when I thought about those young people coming back out and coming into communities. Touching quickly on Scottish Government policies, I'm a strong supporter of what the Scottish Government has done so far of youth crime and reducing reoffending. Getting it right for every child puts the child at the heart of the youth criminal justice system. Preventing offending by young people, a framework for action, also looks at reducing reoffending. Early and effective intervention, that is putting the young person again at the heart of everything we do under GIRFEC, but looking at taking our ways to take them out of the criminal justice system by using diversions or interventions. And the whole system approach is to extend that up to 18-year-olds, but it's also to bring all the partners together. Now, all of these documents, I can provide links for them. I can actually send you the documents if you so wish. I have them with me here in the US, so there's no problem in getting any of this stuff to you. The challenge, I put this up and I actually asked some of the students up at Harvard what it meant to them, and the answer a lot of the time was great film, yeah, really good actors. But then I asked them obviously to think a bit deeper about it, especially the first part of it. What actually happened to Henry Hill? Well, Henry Hill went on and became a gangster. So, was he a self-fulfilling prophecy? The perception for young people with crime.
I'm right.
perception for young people with crime, they're going to have lots of cash, nice cars, some of them have nice boats. You know, that's the perception that the media, and I use the media in the widest sense, whether it be the written media, whether it be the films, that arguably glamorise this lifestyle, and you could say that's what happened under Goodfellas. The reality, somewhat different. What you see here is young men and young women who have been assaulted in the city centre of Glasgow. These are all real photographs, none of this is staged. And what we say to the young kids that we speak to, this isn't a glamorous life. You know, don't be fooled. Don't be fooled by the people who tell you, get in, commit a bit of crime for us and we'll make sure that you get plenty of cash. The reality is depicted in these photographs. The picture in the bottom right you will see is actually a young man sitting in Polmont Young Offenders Institution. Now, these photographs were taken by David Galanders and they're available online for people to view. Excellent photojournalist, and you can look at it through davidgalanders.com, you see at the bottom. So, partnership, the questions. Why do young people commit crime? What factors do we, that's the collective we, need to consider? The social normality. What is social normality? Is it subjective? Is it our social normality imposed on other communities? Who sets the agenda? And what can the collective we actually do? Depiction here is the tower blocks of Glasgow. And in there I have put what I think are some of the key issues, and they're replicated across the different areas. So you'll see violence will appear a couple of times, mental health issues, alcohol issues. And in our rush to make sure that we actually provide all the services that we think are right and impose our social normality, I would argue we're actually clouding the issue. We're obscuring the facts, because each of those areas was operating as a silo. With the best of intentions, we are there. We're putting all these services into communities, but are we actually just masking it rather than addressing the root cause of the issues? So, One Glasgow. One Glasgow came about because of the Chief Executive of Glasgow City Council, our Chief Constable, Mr Stephen House, who's now going to be the Chief Constable of the National Police Force, and a number of senior managers within services such as education and health. So you see the key partners that came to the table: the police, community services, social services in its widest sense, children's services likewise, prosecutors, fire and rescue, health, education, housing providers, the voluntary sector, which is our not-for-profit and our charities, and the Scottish Institute for Policing Research. One thing I would say about the Scottish Police Service to date, we were very good at quickly identifying a problem and then putting services or operational activity in. What we perhaps were not so good at was getting the academic foundation upon which we build our services. With CYPER coming in, headed up by Nick Fife, as Cynthia mentioned earlier, this is going to be a key part of One Glasgow. Now, I should say at this point that One Glasgow is not just about reducing offending, which is the part the police are leading on. It's also about early years, which is led by children's services and education, and older vulnerable adults, which is led by the health. So the hub, what we look to do, great partnership working in the city, but it was done based in individual problems, individual areas. The idea of One Glasgow is to actually co-locate key members of staff from all the organisations to produce a single operational assessment. Now, not just co-location but co-production, because you can always also be in the one building but not communicating. So the idea of multi-dimensional information sharing, and that's getting all the data from each other's systems and getting that to inform the development of the single operational assessment. What I mean by that is John Patterson may be known to the police, may be known to social services, may be known to education, may be known to health, but they're all separate databases and we'll all be dealing with those issues individually. This idea is to bring all of that information together, identify a key lead to deal with John and the issues that John has, but supported by all the partners. Priority planning and tasking and coordination of resources. Again, what we're looking to do there is, rather than have all the resources from the partners deploy to deal with individual problems, have the lead and then figure out what the other partners can do to fall in behind and support the lead organisation. Commissioning of interventions, I'll come back to on another slide. Whole system approach, reintegration and performance management we've touched on, but that will also be at the heart of what the coordinating hub will do. The single plan is what I've mentioned, so you're dealing with John Patterson. What are John's issues? The idea here is to look across all the different facets, whether it's my family, my peer group who's living with me. What are the things that are impacting on my life that are leading me to commit crime or to draw on all the partnership services? Proper case management. What I mean by that is that we have clarity in who's dealing with each stage of the plan. Now, we'll have one plan, but that doesn't stop it being passed between partners if it is right to move the lead agency. Interagency referrals goes without saying. That's if we need services drawn down from specialist areas. I've put UN Convention and GIRFEC compliant at the bottom. Until last year, in fact it's still in law, the age of criminal responsibility in Scotland was 8, but the UN Convention argues for 18, but we've come down to 12. So there's a presumption against prosecution for anyone under 12 except in the most serious circumstances. So the whole system approach in EEI makes Scotland's criminal justice system for young people compliant with the UN Convention. I put this up as much to remind myself as for the partner organisations. We're all very good at dealing with what we can see and perhaps not addressing the issues that lie underneath. So we have the behaviours that manifest itself in aggression or a fight, so the police come along and deal with that. For a long time we didn't actually ask ourselves, well, what was actually causing John to be aggressive? So that's to remind us all that don't just deal with what we can see in front of us. We use this term recency, frequency and gravity in order to identify those causing us the greatest concern. It came about from an analyst called Martin Smith back in Strathclyde, based on a business model. We look at all the systems that we have in the police and now the partners. We score them out of 100. So it started off for domestic violence, but in terms of youth violence, it looks at when John committed a crime, when he was committing crime, how frequently was he committing a crime, and what was the gravity of the offence. If you score 50 and above, you will be sent out for immediate action, proactive action, because you're causing the greatest risk of harm to the community. Now that proactive action can take many forms as we begin to look at the single plan and look at the tasking of resources. If you fall under 50, you also come to the multi-agency hub to look at ways to manage your offending behaviour or your risk score to reduce that and arguably stop you from going up towards 50. I also have a document that explains this in full, and I'll be glad to make that available to you, but that allows us to put an assessment on those individuals that we're identifying as causing the greatest risk to our communities. Touching on commissioning of interventions, the map that you see here, the dark areas cover youth crime and disorder calls reported. This is Glasgow city centre. The lilac dots are licensed premises, and the coloured dots are the ones that are used to represent youth diversions and interventions. One of the questions I asked when I first came to the criminal justice side was what interventions and diversions are being offered to young people in those areas that we know are the highest crime rates. Nobody had ever captured the data before. So over the course of 6 months, got the data in from all the partners, and what you see there is where we have or where we do not have interventions and diversion activities at the times when we know we have youth crime and disorder. So the idea behind the coordinating hub is what we will do if someone wants to provide a service, we will look to identify gaps in service and support the commissioning of new services based on an identified need. What was happening previously is people were going out and sourcing additional funds from charitable trusts, from organisations, from lottery funds, and perhaps providing us with street soccer, street basketball or some other intervention. And it got to the stage that perhaps we had 3, 4, 5 of these running in the same area. The question we were asking is, do we need these? So we actually started speaking to the young people. What do you need? And the most striking thing was actually for young women offenders. and young women who were involved in disorder. A lot of those people had recently taken on tenancies, new properties. They didn't know how to run a house. They didn't know how to actually take care of a property. So through the Housing Association, they converted one of their apartments, use it as a training centre, and actually teach people now how to run a tenancy. From a policing side of things, it reduces the number of calls that we have for disorder, because they now appreciate that what they thought was just having a party is actually antisocial behaviour. So the housing department play their role, the partners play their role in providing some additional support to young women in terms of health, because a lot of the young women are actually young mothers as well, so they get nurse-family partnership support, and it reduces the calls that we, the police, have. But also we've started working with education, because they provide most of the access for schools, to extend the opening hours. So if we were having youth disorder around 7 p.m, 8 p.m. at night, we found that a lot of the diversion activity had perhaps stopped at 5 p.m. So by extending those hours and giving somewhere for the children to go, it's actually reducing the number of calls. It looks simple to see it on the screen, but say it took us around 6 months of work, but it's something that I would strongly advocate that you do. Look at what you have, identify the gaps, get it into the hub or whatever model you use to identify, is this going to solve a problem and fill the gap. Put this up, SOS Bus, another innovation for Glasgow. This cost around $160,000 to kit out. The bus came free from one of our partners, one of the bus companies. We put this in Glasgow city centre Thursday through Sundays from 10 p.m. till 4 a.m. It was introduced this time last year for people going into Glasgow city centre for the Christmas party season. People who may consume more alcohol than they would normally do, people who are not familiar with the city. We put this right in the heart of the city centre. It gives them somewhere safe to go. They can get medical assistance if it's required. They can get support for getting access to transport, directions, and whilst not physically on the bus but immediately adjacent to it, there's also police officers there. If there's any issues of crime or disorder, the police will assist them. First month last year, there was 100 people used that service. Now, you can't always gauge what you prevented, but I would argue that by keeping our community safe and providing this facility, we certainly reduce people's exposure or vulnerability to assault in the city centre. Partnership operational activity, gangs task force and alcohol task force. On the face of it, they look like law enforcement. They're actually multi-agency. The gangs task force will deal with those people involved in gang violence, but they also have all the partners working with them so that once they're arrested, and they can get put into services very quickly. Alcohol task force, similar. We do something in Scotland called a parent alert letter, or certainly in Glasgow. So if you're on the street and you're consuming alcohol and someone is with you who's perhaps not consuming alcohol but is underage, the alcohol task force will undertake to write to that person's parent, carer, or whoever's looking after them, just to tell them that, whilst John was perhaps not committing an offence, he was with someone who was consuming alcohol in a designated place, and we'll leave it to you to take whatever action you deem appropriate. The alcohol task force all wear body cams, and that's something I'm a strong advocate of as well. So when they go to these youth disorder calls, everything is captured on the body cam, and we have a laptop that we take out to young people's parents to actually display the behaviour that they were showing at the time. Because a lot of people think, not my son or daughter, but we can actually show that to them. Flexible policing unit, go into an area. Yes, sir.
You were moving fast. Did you say that they were drinking alcohol in an area where they can consume alcohol?
No, sorry. Drinking alcohol in public is banned in Scotland. We call it designated areas. So if it's designated as a public space, you're not permitted to consume alcohol.
Like juveniles are allowed to drink alcohol?
No.
Okay.
No, sorry. No one is allowed to drink alcohol at all.
In an open place?
Yeah. But where you have a young person, even if that young person is not consuming alcohol but is with someone who is, we will do a parent alert letter to advise their parent or guardian or caregiver that they may be exposing themselves to drinking underage.
John, can you just elaborate a bit on the Gangs Task Force and what are some of the non-police resources that you referred to?
Certainly. Gangs Task Force, using the RFG model, we will identify those individuals who are the most violent, who are involved in gangs. They will be subject to the proactive enforcement activity where we will go out to arrest them for outstanding charges or to go into the areas that we know that gang violence is prevalent. But at the same time, we have a number of partners who work in the city who, once the person has been arrested, we can refer them. We can refer the young person into service so that they will get interventions or diversions. Using the EEI process that I mentioned earlier, it may well be, depending on the crime that's been committed, that we can refer that young person to the EEI coordinator. Now that's a person who carries social work skill set, and they see the crime report that comes in for the police. Now there are set criteria depending on the number of offences the person has committed as to whether they're suitable for diversion, but if they fall into that criteria, rather than putting them into the criminal justice system, the coordinator will assess that individual, working as part of the hub, and look at what is best for that person, what's going to address the underlying need. Now at the same time, we are duty bound, as you saw that the prosecutors were part of the group, to report the circumstances to the prosecutor. But where in the past the police would put forward a set of circumstances and perhaps a short background narrative as to the circumstances leading up to the event, now we're actually able to provide the prosecutor with a lot more detail, and also the fact that we're referring this person or that they're getting interventions or diversion, or they're working with another partner organisation. That allows the prosecutor to take a very objective view on what they decide is going to be their next course of action. So we have that referral mechanism in the city, and it's based primarily in the north and the northeast of the city at the minute for the diversionary support, but EEI is across the whole of the city.
John, what are fire reach courses?
Yep, I'll catch down onto that. I'll touch quickly on community improvement partnership. I mentioned earlier the housing departments, fabulous source of information, underutilised. You have housing officers, housing managers, maintenance officers get in and out of properties every day. We have 2 inspectors, 3 sergeants and 12 constables who now work with the largest housing provider in Glasgow City, supporting their efforts to reduce antisocial behaviour, sustain tenancies. But from our side, it helps with areas around domestic violence and hate crimes, things that perhaps were not being reported to the police, maybe because people weren't comfortable with coming forward to the police or didn't understand the mechanisms for doing so and the support that was available. That's something as well which has provided real good dividends for the communities and for the people who live in the properties. Persistent Offenders Project is dealing with persistent offenders with addiction issues. We have an arrest referral programme where if someone is brought into custody who has an addiction issue and that is the underlying cause of their offending, they can get an immediate referral to an addictions counsellor. Again, as before, it doesn't change the reporting mechanism to the prosecutor, but allows us to actually say that they're seeking help for their addiction. One for the law enforcement I just want to mention quickly is campaign against violence deployments. This is something that's totally revolutionised Strathclyde Police and in particular Glasgow City Centre. Officers like myself whose primary duty sees them working behind a desk for one full day or at least one full day a month will deploy out onto the streets. What that has done is allowed Strathclyde Police to deliver an additional 250,000 patrol hours with no additional cost to the service, because I know what day I'm going to be deployed and I can sort my diary to suit that. But it means that the public are getting the full service from all of the police officers, not just those that are designated to be the frontline response or community officers, something I'm a strong advocate of and I would ask you to consider. Antisocial behaviour units and mobile CCTV are actually partnership resources. We have community wardens who will work in our areas, who will deliver support to the communities. They are uniformed but they are not police. And the mobile CCTV units, absolutely fantastic resource, funded by City Council. They're small vans with telescopic CCTV cameras that are mounted onto the top. We deploy them into areas that we know or strongly suspect have got antisocial behaviour, and it's fantastic because it tells people that they're being video recorded, and the reduction from a partnership approach, the reduction in antisocial behaviour is really good. Fire reach courses. I mentioned that the Fire and Rescue Service were part of the coordinating hub. Where we have community fires, that's fires that may not necessarily be reported to the police, but will lead the fire service to go out, and it may be a bin store that's been set alight, or it may be piles of rubbish that have been set alight. Cost the fire service significant amounts of money to deploy those resources. What we've been doing is working with them to identify those young people involved in setting the fires so that they understand the consequences and it's not a victimless crime, because it could cost $3,000 or $4,000 just to send a fire engine out for 1 hour. So the fire service actually pay for the fire reach courses, so they take those young people that have been identified as either causing fires or been in the area when fires have been set and explain to them the reasons behind that. We're working with the fire service to try and get that introduced into the prison system, so that we know that people that have been convicted and imprisoned for arson will also get that approach, but thus far it's only done in the communities. Outreach workers and referrals we've mentioned. How did we get there? Bottom one is obvious. I would suggest everyone agreed things had to change. Staff were identified and a project group set up. I should say that this has taken us 2 years to get to this stage, and it's not been an easy journey. I'm pretty sure anyone who's worked in partnerships will know that, you know, as long as you keep your goal in sight, you will get there, but it's not always as simple as it first may seem. The key priorities and barriers. One thing I've learned from this is communication. Middle management perhaps were squeezed as part of this project because the frontline officers were being engaged every day. Those at the very top, the chief executives, were buying into this from the start. As I said, the chief executive of the city council and their own chief constable. But middle management perhaps didn't get the respect that they deserved by communicating the plan and vision to them. So there was maybe some stumbling blocks along the way, but hopefully we'll have addressed those now. The programme board oversees everything that we're doing. That's the chief executives. We have started to fully implement these changes now from October. So that's October 2010 to October 2012. It's taken us to get thus far to move to One Glasgow. Now, One Glasgow could be One Washington, it could be One Baltimore, it could be One Boston. The idea is getting everyone together and sharing that vision using the single plan and using the material that you develop through your coordinating hub. The results that are here, I should say, are the results from the partner organisations as we have moved towards One Glasgow. Our first One Glasgow results will come out next year, but as you can see, as a partnership, this is what we've delivered in the last year in Glasgow. Now the figures there are around about 2,000 less crimes, around 200 less serious violent crimes. The reduction in referrals to the Children's Reporter is around 3,000. Now what that means is the Children's Reporter is not having to look at 3,000 reports, which means they are not having to request 3,000 statutory reports from social services. It allows them to concentrate on those children who are needing, who have the greatest need of care.
John, can you define Children's Reporter and what kind of agency do they work for?
The Scottish Children's Reporter Administration is the administration that covers the whole of Scotland for those 16 and under, and also those up to 16 if they already have a supervision order in place. The Scottish youth justice system is held as a model in the whole of Europe because it puts the child right at the heart of it. So the reporter looks at children in need of compulsory measures of care. So you will have a finding of guilt rather than an offence for someone under 16. In the past, the police would report everyone under 16 to the reporter automatically. With the EEI and whole system approach, the coordinators that I mentioned earlier will take some of that burden away and work with the partners to make sure that they get interventions and diversions that are not part of the justice system. They may also submit a report to the reporter if there's already an existing care plan in place. So they have the responsibility of dealing with our young people. But in Glasgow alone, you could see that that's 3,000 less reports that they're having to deal with. So that shows how the partnership approach allows those agencies to concentrate on those in the greatest need of care. 40% reduction in high impact violent offenders, that came from the RAFG methodology. So the threat score of the individuals was reduced. 90% reduction in frequency and severity of offending, again using the RAFG. And this was a cohort of around 50 gang-based individuals. So of those 50, 70% showed a reduction in alcohol and drug use, 65% increased involvement in education. And if I take you back to one of the first slides, which was those people who are in prison, who are showing the educational attainment of an 11-year-old, this is something that we're doing to try and get people re-engaged with learning. And family relationships, something that's really pivotal to everything that we're doing. We need to make sure that there's a strong family network around to support the young people. Business benefits, I think they're there for everyone to see. The process that we're using is hopefully going to become the framework for the new Scottish Police Service, so the adaptability and scalability. Because Glasgow is the biggest city, if it works in Glasgow, we hope it will work anywhere else in Scotland. Joined up approach, these 4 areas for a long time were dealt with very, very well, I have to say, but in silos. What we are looking to do with the coordinating hub is to actually bring them all together, so that no matter where you are in your journey as a young person or an offender, that there will be services there to support you. And I always use the prison service as an example. The prison service are excellent and they don't always get the credit that they deserve. So as part of the entry process, they're looking to identify how we will start to reintegrate these young people. And I said this to some colleagues yesterday, we use the term reintegration rather than re-entry. It might be a play on words, but we want to signify that we are integrating that person back to the community, not just sending them back. So that's the term that we use. Future, single police force we've spoken about. Statutory responsibility to work together, it's actually in the new Police Act of 2012, where it says that the local police commander will work with the local authority chief executive to develop the plans and make sure that all the resources are being used to deal with the collective issues. Now, the Act was written after we had started with One Glasgow. There's been a long history of partnership working in Scotland, so I'm not saying the One Glasgow approach has influenced it in any way, but it's good to see that we were actually heading in the right direction. Something that I hope will ring true with Cynthia, we want to get evidence-based policies, not policy-based evidence. So there's actually using the academic support and foundation, we know why we're doing something rather than actually halfway through stopping to evaluate what we've spent the last 6 months or 12 months actually doing. Bottom one, something close to my heart. Strathclyde Police, keep people safe. We changed our overall aims, objectives, mission statement, simplified it all and say that Strathclyde Police exists just to keep people safe. And I would argue that everyone in the room, that's what you do every day. Something as we get to the end, it's actually something that I keep on my desk in work, just to remind me that we can't just keep doing the same thing and hoping it's going to change. And please come and visit us, because Scotland is a truly magical place and you would be more than welcome to come and visit. And thank you very much.